Myself, Dr. Jibran Ahmed presents to you Simply Pathology, and today we are back with a very important video. Today we are going to understand about the molecular testing of HPV. Now, before you start watching this video, it is advised that you go back and you read the cervical carcinoma and the precursor lesions of the cervix. Also, you should go through my video on the cervical screening that is in place. And as we know that the cervical screening program is basically based on the cytological evaluation of the pap smears taken from the cervix. So that is the standard procedure that is being followed throughout the world. Now, in this particular lecture, we are going to see another important type of test which is done for screening of the cervical carcinoma, that is the molecular testing of HPV. That is, we want to detect the HPV DNA or the RNA, okay, by molecular means, okay, and we want to evaluate the use of this particular testing as a primary screening tool, okay, how much it is effective, what are the advantages and what are the disadvantages. So with this base in our mind, let us begin today's topic of discussion. So as we know that there are 14 high risk human papilloma virus which is causing cervical carcinoma. Now, out of these 14 high-risk HPV, if you see, there are two important HPV. One is your HPV 16 and HPV 18. Now, HPV 16 is associated with 53 to 62% of all the cervical carcinoma cases, whereas the HPV 18 is associated with 13 to 15% of all the cervical carcinoma cases. Now, the other high-risk HPV includes HPV 31, 33, 35, 39, 45, 51, 52, 56, 58, 59, etc. So, there are many high-risk HPVs. Out of them, 16 and 18 are very important, and out of 16 and 18, 16 is associated with majority cases of cervical carcinoma. Now, as we already understand one important thing, that till date, the cervical screening program is basically based on the cervical cytology, okay. Cervical cytology has been the mainstay of cervical cancer prevention. It is already a very successful screening program, okay, and further improvements in this successful screening program is very difficult to achieve. Now, it is a primary screening tool, okay, with HPV molecular testing done as an adjunct to triage borderline and low grade abnormalities, as well as HPV is used as a test of cure after treatment of pre-malignant change in the cervix. Now, what is triage and what is the test of cure? We will discuss in details, okay, in the later half of the video. So, don't worry about that. So, till now, remember that cervical cytological evaluation is the primary screening tool, and molecular testing for HPV virus, it is only done for triaging and as a test of cure. What is triage and what is test of cure, we are going to see in the later half of the video, okay. Now, remember, today's topic of discussion, that is the molecular testing of HPV, is mainly based on the studies that have been conducted in the United Kingdom, and we will be, we are going to, see the different methods of molecular, testing of HPV also, along with the advantages and disadvantages of the molecular screening process, okay. So, as we have seen in England, if you see the screening intervals, okay, is as such. Between the age of 25 to 49 years, the screening is done 3 yearly, whereas between the age of 50 to 64 years, it is done 5 yearly. Now, very importantly, automated screening on cytological material is on the rise, okay, is on the rise in developed countries like the United Kingdom. And very importantly, quality assurance and training is a part of the national program. So, whatever screening process or procedure is there in place, it is always evaluated and it is a part of the national screening program in the United Kingdom. Not only this, as a part of the national program, there is also widespread HPV immunization drive. Okay, so children between 12 to 13 years to 18 years of age, okay, they are administered bivalent or quadrivalent vaccines, okay, against HPV, okay, and because such vaccination is carried out in the school itself, okay, therefore there is a very high coverage of approximately 80% in this age group. Now, regarding the vaccines, the bivalent vaccine, okay, which is against HPV 16-18, and the quadrivalent vaccine, which is against 16-18 as well as 6-11. So in details, we have read about the vaccines, okay, in our cervical carcinoma screening and HPV vaccination, video that is already there in YouTube. So you can go and watch the video on the HPV vaccines. Okay, now in the older girls, okay, this coverage falls to 30 to 35% only. So the coverage is very less in older girls. Okay, so current cytological screening program that we are having, that is the PAP screening that we are doing. The good thing is that it is highly specific in nature. Okay, whereas the bad thing is that it has having a decreased sensitivity. Okay, the sensitivity of the cytological screening is quite less. Okay, so just to revise, okay, currently we are screening the cervical cancer by cervical cytology. Okay, already this cervical cytological screening process is a very successful screening program. Okay, and it is very difficult to achieve further improvement in this program. It is the primary screening tool, and along with that, the molecular testing of HPV as of now is only done for triaging and as a test of cure. Now, what is triage and what is test of cure, we will discuss in later half. Okay, now these tests that we are going to read today, the studies were mainly conducted in the United Kingdom. So we are reading this lecture in terms of what is happening in the United Kingdom. So in England, the screening intervals, okay, for 25 to 49 years was 3 yearly, and for 50 to 64 years women, it was 5 yearly. Most of the screening is based on liquid based preparation, and we are using automated screening for screening the cytological material. And as a part of the national program, quality assurance and training is a very huge part of the national program. Also, the drive for HPV immunization is very high, and high coverage is there for the younger age group between 12 to 13 years through 18 years, because in that time they are receiving the vaccination in their school itself. The current cytological screening process that we are having in place, okay, the good thing is that it is highly specific, but the sensitivity is quite low. Okay, so what do you mean by that it is highly specific? It means that on a cytological evaluation, if you are getting an abnormal smear, okay, and when that is followed by a biopsy or colposcopy, then 80% cases will show abnormality. Therefore, the test is highly specific. Okay, the test is highly specific. That means whatever abnormal cases are there, this cytological screening is going to detect those cases very specifically. Okay, it is not going to leave out any abnormal case. So if you are positive on a PAP screening or on a cytological evaluation, then there are high chances that the cervical abnormality is present. Okay. So what are the potential uses of HPV technology? Okay, so now we are going to see the HPV technology, that means the molecular testing for the HPV. So what are the potential uses? So as I was telling you, the first very important use of this molecular testing is triaging. Now what is triaging? Let me give you an example. Now, for example, if there is a disaster in any place or in any area, there is a disaster, okay, and a lot of people have got injured, many people have died, and some people are seriously injured, some people are mildly injured, okay. So, for example, in such a situation, there are limited number of doctors. So, we have to triage the area. Triage means now those patients who are dead, now you cannot do anything about the dead person that is already dead. So, you might not give much attention to the dead person. Then there are certain individuals who are mildly injured. Okay, so the mildly injured people, they can be tended after some time. Okay, but those who are alive but they are seriously injured, they need immediate attention. So this prioritization, okay, of patients is called as triaging. Okay, this is what is known as triaging. Okay, so for example, normally whenever you are detecting any low grade abnormality in the cytology, okay, then the action or the next mode of action or the treatment is that you repeat cytology in 6 months. Okay, so there is a surveillance. So every 6 months you have to repeat the cytology. But what is seen that the patient is having very poor patient compliance. So those who are detected with low grade abnormality in cytology, they do not turn up after 6 months. Okay, so as a result, the patient is lost to follow up. So it was devised. So what? So here comes the role of the molecular testing of HPV. So for example, you did the classical test. Okay, you did the cytological evaluation and you have got a low grade abnormality of the cervix. Okay, if that is followed by the HPV testing, that is human papilloma virus molecular testing is done, and on the basis of that, okay, if the test comes out to be positive, then in that time only we are going to guide the patient towards colposcopic biopsy and further evaluation. If the HPV test comes out to be negative, okay, then the patient will be returned to routine screening, the 3-yearly and the 5-yearly screening that we have seen. Why it is called as triaging? Because only those cytological smears which have tested for low grade abnormality or which is showing low grade abnormality, they are further subjected towards the HPV testing. So this is triaging. Okay, so on a priority basis, or on, only those cases, okay, which are showing abnormality in cytological evaluation, only those are subjected to HPV testing at the same time. And if the patient is positive for HPV, then we are going for immediate colposcopy. If they are negative, then we are returning the patient to routine screening. So that is why herein comes the role of the molecular testing of HPV, that is in triaging. Now with this method, the process is quite cost effective and it is popular with women. Okay, so this is the first potential use of the molecular testing of the HPV, that is they are used in triaging. Okay. Secondly, as I told you that HPV is also used as a test of cure. Now what is the test of cure? Let us try and understand. So normally a patient who has been diagnosed with a high grade sin, okay, high grade sin, sin stands for cervical intraepithelial neoplasia. So normally if a person is diagnosed with a high grade sin on cytology, the patient is going to receive some kind of treatment. So after the treatment of such patients, okay, of high grade sin, they are kept on annual cytological evaluation for 10 years. Now this is relatively a long period of time. The patient has to come every year. Okay, so what was decided or what was seen? It was observed that around 80% of these kind of women, okay, who are coming after treatment on their first follow-up, 80% of the women were showing negative, they had a negative result on cytological evaluation and on HPV testing. Okay, so it was decided that for such women on their very first follow-up, okay, both cytological as well as HPV testing should be done as well. And if both the tests are coming out to be negative, then the patient should be returned to routine screening rather than annual screening. Okay, so this is the test of cure. So what is the meaning? Now remember that our normal cytological evaluation, they are having a low sensitivity and a high specificity. But the molecular testing of the HPV is opposite. They are having a very high sensitivity and very low specificity. So what is happening over here, that if your test is coming out to be negative with the molecular testing of the HPV, then it is quite possible that you are negative. Okay, so the negative predictive value of molecular testing of HPV is very high. So I will just explain you once more. Okay, so a positive pap test is more important, okay, because a positive cervical pap test means that you have the abnormality. Okay, there is a high specificity, whereas there is a very high sensitivity for your molecular testing of HPV. If you are getting a negative molecular test of HPV, that means you are sure shot you don't have any abnormality. Okay, so a positive cytological evaluation is more important and a negative molecular testing of HPV is more important. Okay, so always remember this point very clearly. Okay, so if a HPV test is coming out to be negative, that means that you have been cured of the disease, and that is why this is called as the test of cure. Okay, I hope you have understood. Thirdly, molecular testing of HPV can be used as a primary screening tool, but there are certain disadvantages. So as I told you, this test is having a very reduced specificity as compared to the cytological test. Okay, but on the contrary, the sensitivity of the molecular testing of HPV is very high. Now, HPV infection in the absence of SIN2 plus lesion is extremely common. Okay, so what is happening that so all positive HPV cases, so all the cases who are testing positive, okay, in the molecular testing of the HPV need not necessarily have the abnormality in the cytological evaluation. Okay, so the sensitivity of the test is very high. That means even those individuals who are not having abnormality will show a positive HPV testing. Okay, but the specificity is very less for the HPV for the molecular testing of the HPV. That is what I am telling you. Okay, now what are the advantages of the HPV testing? Okay, so why we should adopt the molecular testing of the HPV virus? First of all, they have a increased productivity. The productivity of is very high. What do you mean by this? So normally whatever cytological evaluation we are doing, it requires a huge training. So some trained individual is required to take the pap smear, to take the sample from the females. Okay, then you have to have a quality assurance program in place. Okay, so as to standardize all the process that is taking place. And again, very importantly, you need to be trained for identifying the abnormalities. Okay, so even a cytotechnologist has to be trained so as to screen all these slides. Okay, so you need some kind of training for cytological evaluation. Plus, quality assurance has to be there, and this is very much required to achieve a high sensitivity, as we already know that the cytological evaluation is having a low sensitivity. So to increase the sensitivity, we have to have a good training, and a good quality assurance program has to be in place, and this is the requirement for cytological evaluation. But if we are doing the molecular testing of the HPV, that is HPV based screening, they can easily achieve high sensitivity. They can easily achieve high sensitivity. Only limitation of this test is decreased specificity, as we have already seen. Okay, and remember, the HPV testing is quite simple and does not require that much of training. Okay, so it is already having a very high sensitivity, and you remember that any test which is having a high sensitivity is the requirement for any primary screening program. Okay, so the productivity of the HPV screening or HPV testing is very high. Okay. Next, we are having, as I told you, the HPV testing, they are having a high negative predictive value. So see, if you are getting a positive molecular test of HPV, that is not that much important, because you may or may not have the disease. But if you are having a negative HPV testing, that it is sure that you are not having the abnormality. This is the importance of the molecular testing of HPV. So a negative molecular test of HPV is very significant, because if HPV testing is negative, then it provides reassurance that truly you are not having the disease or you are not having any abnormality. That is why it is also used as a test of cure. And possibility of self-testing. Now, you can have kits and you can yourself carry out the test. Okay, but self-testing is not possible with the cytological evaluation. So anyone with the kit can perform this HPV testing on their self. Okay, so there is a possibility of self-testing with case of molecular testing of HPV. So these are the three very important advantages of the molecular testing of the HPV virus. Now, genetics of the HPV, again we are not going into the details, because we have already read about that in the in the chapter of cervical carcinogenesis. So over here just we are going to see certain relevant genes and their function. So there are 6 early genes and there are 2 late genes. So the 6 early genes are E1, 2, 4, 5, 6, 7. E3 was seen in bovine papillomavirus, not seen in human being. Now E1 is important for viral replication, E2 in transcription regulation, E4 is disrupting the cytokeratin, E5 interaction with growth factor receptor, E6 inhibits the tumor suppressor gene P53, and E7 inhibits the tumor suppressor gene, that is RB. Now if you see L1 and L2, they are the late genes and they are coding for the viral capsid proteins. Now comes the molecular testing for the HPV. Now comes the very important part. So in the United Kingdom, there were 5 important tests that were approved, okay, and they were using the samples, that was the thin prep and the sure path LBC or liquid based cytology sample. Now remember that normally the cytology is done by 2 ways. One is the conventional preparation, wherein you are conventionally taking the sample from the cervix and you are smearing it on the slide directly. That is a conventional preparation. And you have a liquid based cytology preparation, wherein you take the sample and you are processing the sample in a liquid preparation, and there is a specialized system which is in place for actually evaluating the LBC samples. Okay, so this is some other discussion, but over here these tests are usually accepting liquid based cytology samples, and the method is thin prep or sure path LBC samples are only accepted for carrying out this molecular testing of the HPV. Okay, so the number 1 test that we are going to see, which is one of the most important tests and most widely used test, is your hybrid capture 2 assay or the DrJIBRAN test. Now over here we are utilizing certain RNA probes which are reacting with the DNA targets to form a RNA DNA hybrid. then we are making use of monoclonal antibody which are acting against this RNA DNA hybrid, and such reactivity of the monoclonal antibody against the RNA DNA hybrid is detected by means of chemiluminescence assay. Now the cutoff of 2 RLU, that is 2 relative light unit cutoff, if it comes out, this is taken as positive. It is a semi-quantitative method and it is quite robust and reliable method. So this is the first test, that is the hybrid capture 2 assay, that is the DrJIBRAN assay. Then we are having 2 and 3, that is Abbott real time and Roche Cobas. Now both these systems are based out of RT-PCR or real time PCR to detect the HPV DNA. Okay, and both these tests, they can be used for other diagnostic tests, mainly for virological evaluation or testing. Then the fourth important test is the gene probe aptima. Now it is only approved method that is detecting the RNA rather than the DNA. Therefore this test is more specific, slightly more specific than the other molecular testing of the HPV. Now most of the HPV tests, they detect the viral DNA, okay, they come out to be positive. So most HPV tests detecting the viral DNA, okay, they come out to be positive, but until E6, E7 has integrated, this test will become negative. So what they are saying, that most of the other HPV tests, that is detecting the viral DNA, when they are coming out as positive, okay, but remember this test is coming out negative until and unless the E6, E7 oncoproteins have integrated with the host DNA, okay, until they have integrated with the host DNA. So while other tests which are detecting the viral DNA will come out to be positive, this test will remain negative until E6, E7 oncoproteins has truly integrated. And remember, E6, E7 oncoprotein integration into the host DNA is actually the first key step in oncogenesis. Okay, so this test is more specific and is going to detect, they are going to come out to be positive only once the process of oncogenesis has started. So this test is little bit more specific. So try and understand, most of the other tests, okay, they will become positive. Okay, while most of the other tests will become positive, this test will remain negative until the E6, E7 has integrated with the host DNA. Okay, only when they have integrated this test, that is the gene probe aptima, will come out to be positive, and that is why this test is quite specific. Okay, it is highly automated system capable of high volume tested. Also, they are used for other virological investigations like detection of hepatitis, HIV, chlamydia. Now, hologic cervista, this is the fifth important testing. It is utilizing the novel detection method, that is the invader probe chemistry. It is achieving 1 to 10 million fold amplification of the HPV DNA. So these are the 5 important testing systems that you should remember, which is being used at the present moment. And you should remember all of them, they are using the thin prep SurePath liquid based cytology samples, okay, for evaluation. Now, very importantly, the testing is, so if you are getting a positive test for HPV 16 or 18, that is equivalent, that is giving you an equivalent risk, okay, that is accorded by cytological evaluation, wherein you are getting an ascus or a borderline change. So it is similar to that. Now, all the 5 testing systems that we have seen, they are highly consistent. They are providing highly consistent results. Means all of them are having the same results. Okay, so all of them are very nice. Just that the gene probe aptima test is little bit more specific, okay, as compared to the other test. Now, if you look at what are the biomarkers, what are the biomarkers of this HPV testing or the HPV? Now, since HPV testing is having a decreased specificity, further investigations are required to improve the specificity of the HPV testing. So what you can do, that along with the HPV, if that test is coming out to be positive, then you can go for a further cytological evaluation, as well as you can carry out certain molecular biomarker assays. For example, you can go for immunohistochemistry using P16. Okay, now P16, remember, is overexpressed when the E7 oncoprotein is binding to the tumor suppressor gene, that is the RB. So P16 can be regarded as a surrogate marker of HPV infection. So this is one of the molecular biomarker. Another is you can also use Ki67, which is a proliferation marker. Okay, so both of them are serving as a molecular biomarker of HPV infection. So if you are getting a positive HPV along with a positive P16 Ki67, then that is increasing the specificity and indicating a underlying abnormality. The practical implications of the molecular testing of HPV. Remember, if HPV testing is used as a primary screening tool, okay, then in that situation, there will be around 80% reduction in the cytological sampling. Now, this is going to further centralize the HPV testing and cytology into small number of high volume centers. Now, in today's world, if you see, a lot of places are carrying out cytological sampling. And because this process is a little bit, it requires, good training, and it is the, little bit resource demanding. So basically this test cannot be centralized, okay, but because HPV testing is a little bit easier as compared to cytological sampling, so what is going to happen, a large number of tests will be performed in small number of places. So we will have small number of high volume centers doing lots of such testing, and the amount of cytological sampling which requires such a lot of expertise, that is also going to come down. So again, this procedure can be done in a large volume at a single place only. Now, major re-engineering of what is already a successful program, it is presenting a huge challenge. As I already told you, that current HPV cervical carcinoma screening program based on cytological evaluation is already a successful program. How we can make it more successful, it presents a huge challenge. It is just detected of large number of positive cases. Okay, now very important thing is that that this HPV testing, if we are doing the molecular testing of the HPV, okay, so just by detecting large number of positive cases, okay, is not enough. That is the easiest part. Okay, that is the easiest part. Now, just by detecting large number of HPV cases. Now, for example, if we are using the HPV, a molecular testing of HPV, they are having a high sensitivity. So, a large number of cases will become positive. So, just by getting the positive, increased number of positive cases is not the job done. That is the easiest part of any screening program. Now, that has to follow by colposcopic evaluation, histopathological evaluation, and treatment modalities should be available. So you just cannot, screen a patient, tell the patient that you are positive for this particular condition, and then tell them that we don't have anything available. No. So very important thing is, so before we are rolling out this molecular testing of HPV, we have to ensure that we are having adequate number of centers which is going to provide colposcopic evaluation, histopathological evaluation, and which are going to provide the treatment which is required for the positive cases. Okay, so using HPV for molecular testing is going to increase the sensitivity of the test, but at the same time it is also providing an environment which has to be equipped with all these things. Okay, so that is also very important. So we have to exercise caution at this point. Okay, just by introducing molecular testing of HPV is not enough. We need to have things ready to deal with the positive number of cases. Okay, unless these are present, there is no point of getting a positive test. Okay, now HPV testing, if you see in the settings of resource poor countries like India, this is quite expensive. It is resource demanding. It requires continuous water supply as well as electricity and a clean environment to carry out the testing. So in case of resource poor setting, two HPV tests has been introduced. One is the CARE HPV test, which is again based out of hybrid capture 2, and a lateral flow test. Now both these tests, they do not require water, they do not require electricity or any kind of refrigeration, and also provide faster results. So with this, we have discussed in details about the current cytological evaluation that is in place. We have discussed what is the molecular testing of HPV, what are the advantages, what are the disadvantages of this test, what are the practical implications of this test, what are the different types of tests which are in place, and what are the tests which we can carry out in a resource poor setting. So thank you very much for watching this particular video.